Bonjour tout le monde. Hello, everyone. Happy to be here today with Minister Hussen, Minister LeBlanc, and Dr. Njoo. I'd like to start by thanking all the candidates, volunteers, election workers, and most importantly, the tens of thousands of voters who participated in by-elections both in Toronto Centre and York Centre. Yesterday shows that even during a pandemic, Canadians believe in the strength of our democratic institutions. I'd also like, obviously, to congratulate Marcy Ian and Yara Sachs on being elected as the new Liberal Members of Parliament for Toronto Centre and York Centre. Through her over 3 decades of work as an award-winning journalist, Marcy brings a passion for advocating for vulnerable communities. And as a successful small business owner, Yara has first-hand experience of what our businesses are facing during this pandemic. Both Marcy and Yara are dedicated, progressive community advocates who are committed to making the lives of the people in Toronto Centre and York Centre even better. We look forward to having both these strong women join our progressive team as we work to support our communities and to build back better. Over the past few days, we've seen record cases of COVID-19 across the country, and it's a cause for concern. Behind each new number is a friend, a parent, a neighbor, or a senior. People's lives are at stake, and we all need to do our part. So follow your local public health guidelines, wear a mask and keep a safe 2-meter distance from one another, and download the COVID Alert app. It's easy, it's free, and with over 4.8 million downloads, it'll help you do your part to protect your friends and loved ones. Together, we will get through this. Au cours des derniers jours, nous avons enregistré des nombres records de cas de COVID-19 un peu partout au pays. La situation est inquiétante et il faut la prendre au sérieux. Chaque nouveau cas, ce n'est pas seulement un chiffre ou une statistique, c'est un ami, un membre de notre famille, un voisin ou une personne âgée. Quand la vie des gens est en jeu, il est important de tous faire notre part. Continuer de suivre les directives locales de santé publique, porter un masque, respecter la distance sécuritaire de 2 mètres et télécharger l'application gratuite Alerte COVID. Since the pandemic started, many folks have found themselves working from home. And in cases where they've needed to self-isolate, most Canadians have been able to do so because they have a roof over their heads. But imagine if you didn't have a home, especially during a Canadian winter. Sadly, that's the reality for far too many Canadians, and our government is taking action to change that. Since 2015, we've created a national strategy to make housing a priority, with thousands of units constructed and provided affordable housing for over 1 million people. We took this issue seriously since forming government, and now that the pandemic has made housing needs more acute, we're stepping up again. Last month, Minister Hussen announced an investment of $1 billion for the new Rapid Housing Initiative. The goal of the program is to give the most vulnerable a safe place to live by quickly creating up to 3,000 new affordable housing units. Today, I can share more details about how this funding will be used. The Rapid Housing Initiative will be equally split between the major cities stream and the projects stream. Right now, our largest cities face a growing need for safe and affordable housing. We're investing $500 million for immediate support to build long-term housing for municipalities that have the highest demand. We've also opened up applications for the second half of funding through the projects stream. Today's announcement is part of our commitment to eliminate chronic homelessness in Canada, as we announced in the throne speech, while also creating good jobs in the housing and construction sectors. Aujourd'hui, j'annonce que notre plan d'1 milliard de dollars pour soutenir les Canadiens vulnérables dans le cadre de l'initiative pour la création rapide de logements sera divisé en 2 volets, le volet Grande Ville et le volet Projet. En ce moment, nos plus grandes villes font face à une demande croissante pour des logements sûrs et abordables. Nous investissons donc 500 millions de dollars dans l'aide immédiate à la construction de logements à long terme pour les municipalités où la demande est la plus forte. La deuxième moitié du montant ira pour le volet projet, qui acceptera des demandes pour les municipalités, les provinces et les territoires, ainsi que pour les organisations sans but lucratif et les corps dirigeants autochtones. L'annonce d'aujourd'hui s'inscrit dans notre engagement à éliminer l'itinérance chronique au Canada, comme nous l'avons annoncé dans le discours du trône, tout en créant de bons emplois dans les secteurs du logement et de la construction. Canada is now in the second wave of this pandemic. That comes with new challenges for small business owners, and as I told the Canadian Chamber of Commerce yesterday, we're stepping up to help, as we have since day one. Earlier this month, we announced that we would strengthen the programs that have been a lifeline for small businesses by introducing an extended wage subsidy, which covers up to 65% of eligible wages. Business owners like Steve and Cami of Steve's Poke Bar in BC will be able to keep their employees on the payroll. For support on rent, the new Canada Emergency Rent Subsidy will go directly to businesses, not to landlords. And those who have to close temporarily because of a local public health order will be eligible for an additional 25% support. That brings the total of 90% of rent covered for the hardest hit businesses. And to help cover other costs, we've expanded the eligibility for the Canada Emergency Business Account while increasing the total amount to $60,000. Depuis hier, les entreprises qui exercent leurs activités à partir de comptes bancaires personnels ont maintenant accès aux prêts accordés dans le cadre du compte d'urgence pour entreprises canadiennes en ouvrant un compte commercial auprès d'une institution financière participante. En ce qui concerne les autres mesures, comme la subvention salariale et la subvention pour le loyer, on va déposer un projet de loi sous peu. J'espère que tous les députés de la Chambre des communes se joindront à nous pour adopter cette mesure d'aide cruciale pour les entreprises canadiennes. I'd like to end this morning by taking a moment to recognize all of the women and men across the country who keep Canadians fed. Our government is here to support them just like we have been since the start of the pandemic. Today, Minister Bibeau will outline how people in BC can apply for the Emergency On-Farm Support Fund. People in other provinces will also be able to apply soon. Le fonds d'urgence pour les mesures de soutien à la ferme de 35 millions de dollars est déployé province par province pour aider les exploitants agricoles et assurer la santé et la sécurité des travailleurs agricoles d'ensemble du pays. La ministre Bibeau va en parler plus longuement plus tard aujourd'hui, mais on va continuer de faire notre part afin de soutenir les gens qui travaillent fort pour nous permettre de nourrir nos familles. Merci beaucoup. Je cède maintenant la parole au ministre Hussen.
Merci, Monsieur le Premier ministre. Je voudrais commencer par reconnaître que nous sommes rassemblés sur le territoire traditionnel dans cette idée de peuple algonquin Anishinaabe. Comme l'a dit le Premier ministre, les grandes villes du Canada font face aux effets dévastateurs des niveaux croissants d'itinérance et de besoins de logement. The COVID-19 pandemic has only underscored and worsened an existing problem. Now more than ever before, we have to ensure that each and every Canadian has a safe and affordable place to call home. And our government's new rapid housing initiative is doing exactly that, and it is an urgent response backed by a significant federal investment of over $1 billion. Our team at the Canada Mortgage and Housing Corporation is ready to get funding out the door very quickly through two separate streams, as the Prime Minister has mentioned. First, the major cities stream. This is meant to go immediately in the next number of days, to cities that need it the most. This means the cities with the highest levels of renters who are in most need of housing, as well as the largest number of Canadians experiencing homelessness in these communities. So at this point, I want to thank Carol Saab, and all of her teammates at the Federation of Canadian Municipalities who were instrumental in helping us arrive at this final list. And the cities that we're targeting are Quebec City, London, Waterloo, Halifax, Hamilton, Winnipeg, Victoria, Surrey, Edmonton, Calgary, Peel, Ottawa, Vancouver, Montreal, and Toronto. I spoke to the mayors of these 15 cities a few days ago. They're fully on board with our plan, and they're committed to turning this significant federal investment rapidly into housing for vulnerable Canadians. The second stream of the Rapid Housing Initiative also includes $500 million in funding. It will support specific projects brought forward by Indigenous governing bodies, organizations, nonprofit organizations, other municipalities, provinces, and territories. CMHC will be accepting project applications till December 31st, and all applications will be assessed within 30 days so that work can get started right away. These are partners that we've already worked with in the past, and we have no doubt that they will be able to mobilize quickly and harness this significant federal money to turn it into housing, to build modular housing, to convert existing properties into housing, and to purchase land for rapid housing construction. We will work together with our partners together and in the coming weeks, months, and years to build more housing for the most vulnerable Canadians so that they can be safe for now and thrive in the future. Merci beaucoup. I want to now turn it over to Dr. Noor.
Merci, thank you. Good afternoon, good morning. Bonjour à tous et à toutes. There have been 220,213 cases of COVID-19 in Canada, including 9,973 deaths. Nationally, there are close to 26,000 active cases across the country. Based on the latest national data, labs across Canada have tested an average of close to 75,000 people daily, with just over 3% testing positive. Yesterday, a total of 4,109 cases were reported nationally. 1,686 of these cases were backlog cases from the weekend, and 2,027 were newly identified yesterday, excluding Alberta, which has not yet reported Monday cases nationally. This brings the average daily case count to almost 2,700 cases. There are also increased numbers of people experiencing severe illness. Over the past 7 days, there were on average almost 1,070 individuals with COVID-19 being treated in Canadian hospitals, including 224 in critical care, and an average of 28 deaths were reported each day. Il y a eu 220 213 cas de COVID-19 au Canada, dont 9 973 décès. À l'échelle nationale, il y a près de 26 000 cas actifs. Selon les derniers chiffres à l'échelle nationale, des laboratoires de partout au Canada ont analysé les tests de dépistage de plus de 75 000 personnes en moyenne quotidiennement, dont un peu plus de 3 % ont reçu un résultat positif. Hier, 4 109 cas au total ont été signalés au pays. De ce nombre, 1 686 étaient des cas accumulés au cours de la fin de semaine et 2 027 étaient de nouveaux cas enregistrés hier, à l'exception de l'Alberta, qui n'a pas encore signalé à l'échelle nationale les cas de lundi. Cela porte le nombre de cas signalés quotidiennement à presque 2 700. Le nombre de personnes souffrant de symptômes graves augmente également. Au cours des 7 derniers jours, en moyenne, près de 1070 personnes atteintes de la COVID-19 ont été traitées dans les hôpitaux canadiens, y compris 224 en soins intensifs et 28 décès signalés quotidiennement. Though the pandemic continues to play out differently across Canada, there are many similarities when it comes to the factors that contribute to the spread of COVID-19. During the spring wave, the virus was our biggest challenge. There were many unknowns, including which public health measures were most effective to bring the infection rate down to manageable levels. Now we have much a better understanding of how the virus behaves. Our challenge now is in adapting our behavior to not give this virus any opportunity to spread. Bien que la situation liée à la pandémie continue de se dérouler différemment dans l'ensemble du Canada, les facteurs contribuant à la propagation de la COVID-19 comportent de nombreuses similitudes. Lors de la vague printanière, le virus était notre plus grand défi. Il y avait de nombreux inconnus. On s'interrogeait notamment sur les mesures de santé publique qui seraient les plus efficaces pour abaisser le taux d'infection à des niveaux gérables. Nous comprenons maintenant beaucoup mieux comment le virus se transmet. Notre défi consiste à adapter notre comportement pour qu'il ne se propage pas. In many areas where COVID-19 is resurging, there are outbreaks in settings like long-term care homes and other group living, working, and learning environments. Public health is focused on detecting these outbreaks so they can act quickly to control the spread. But these are not the only settings where COVID-19 is spreading. Community spread from everyday activities to smaller and larger organized social gatherings is contributing to the caseload in municipalities across Canada. Let's remember that the lower the level of disease activity in the community, the lower the risk of outbreaks in closed settings. Dans les nombreux secteurs où la COVID-19 réapparaît, on assiste à des éclosions dans des milieux tels que des établissements de soins de longue durée, des environnements d'apprentissage, de travail et de vie en groupe. La santé publique se concentre à la détection de ces éclosions pour qu'elle puisse agir rapidement pour contrôler la propagation. Toutefois, ce n'est pas les seuls milieux où la COVID-19 se propage. La transmission communautaire dans le cadre d'activités quotidiennes ou encore lors de petits ou de grands rassemblements sociaux contribue à l'augmentation des cas dans les municipalités partout au Canada. Rappelons-nous que plus le niveau de transmission de la maladie est bas au sein de la communauté, plus le risque d'éclosion dans les milieux clos est faible. Dr. Tam and I have also said that cases reported today are a reflection of exposures and infections that occurred up to 2 weeks ago. In some areas, we are learning that gatherings during the Thanksgiving weekend contributed to the elevated case counts we are seeing today. Our actions matter. La Dr. Tam et moi-même avons aussi mentionné que les cas signalés aujourd'hui correspondent aux expositions et infections survenues jusqu'à 2 semaines auparavant. Dans certains secteurs, nous apprenons que les rassemblements tenus pendant la fin de semaine de l'Action de grâce ont contribué au nombre élevé de cas que nous enregistrons aujourd'hui. Nos gestes comptent. The solution is simple. Implementing it is difficult. But the choice is clear. We must consistently maintain effective public health measures, stay home if we have symptoms, even mild ones, wash our hands frequently, maintain physical distancing, and wear a mask as appropriate. Letting down our guard and letting this virus win is not an option. La solution est simple, sa mise en œuvre est difficile, mais le choix est clair. Nous devons maintenir constamment des mesures de santé publique efficaces, demeurer à la maison en cas de symptômes, même faibles, se laver les mains fréquemment, maintenir la distanciation physique, porter un masque au besoin. Abaisser la garde et laisser ce virus gagner, cela ne constitue pas une option. Merci. Thank you very much.
Thank you, Dr. Njoo. The Prime Minister will be available to answer questions for 20 minutes. Ministers and doctors will remain available for 20 minutes afterward. Merci beaucoup, Dr. Njoo. Le Premier ministre répondra à un total de 20 minutes de questions aujourd'hui et un autre 20 minutes suivra pour répondre à d'autres questions pour les ministres et le docteur. En commençant par le téléphone aujourd'hui. Opérateur, c'est à vous.
Thank you. Merci. Première question, Christy Kirkup, The Globe and Mail. Line open.
Good afternoon. Prime Minister, you clearly have continued confidence in RCMP Commissioner Brenda Lucki, but one of your own cabinet ministers says he disagrees with her assessment of the RCMP's response to violence faced by Mi'kmaq in Nova Scotia. So what concrete...
Christy, I think we lost you here. Would you repeat the question?
Juste un petit moment. Ms. Kirkup, line open again.
Hello, can you hear me? Hello, can you hear me?
We can hear you.
Yes, go ahead again.
Okay. Thank you for your patience. Prime Minister, you clearly have continued confidence in RCMP Commissioner Brenda Lucki, but one of your own cabinet ministers disagrees with her assessment of the RCMP's response to violence faced by Mi'kmaq in Nova Scotia. What concrete evidence do you have from the RCMP and from the Commissioner that the force is willing and able to look within to address systemic racism in the force?
I think we all recognize that over the past months, years, and decades, our systems have consistently failed to adequately protect and support Indigenous peoples and racialized Canadians. And the RCMP has certainly been part of that. We need to do better. We need to pledge every day to work with Indigenous communities, with racialized Canadians, and with all Canadians to reduce systemic racism. We will continue to work with the Commissioner, with the members of the RCMP, and with all institutions that serve Canadians to reduce systemic discrimination and racism throughout our country.
Following up, Kirsty?
And Indigenous experts, Prime Minister, say the Correctional Service of Canada cannot be trusted to tackle the impacts of systemic racism, including the greater number of racialized Canadians who are institutionalized. What specific steps will your government take to hold the CSC accountable?
I think addressing systemic racism requires us to hold all institutions accountable and recognize that every institution has changes to make and improvements to in order to serve all Canadians fairly and properly, particularly racialized and Indigenous Canadians. But we know that the process whereby Indigenous or racialized Canadians go through the justice system and end up in our correctional facilities is also part of the challenge. So yes, we have to improve the work we do within Corrections Canada to fight systemic discrimination of racism within their processes, but we also have to go upstream into the justice system and even further up to community supports and investments that give people better opportunities than currently exist within our system that needs to be fixed.
Merci. Opérateur, prochaine question téléphone.
Thank you. Merci. Prochaine question, Hélène Buzetti, à vous.
Oui, bonjour, M. Trudeau. J'aimerais vous entendre à propos de la décapitation du professeur Samuel Paty en France. Pourquoi n'avez-vous pas commenté l'affaire ou au moins appelé Emmanuel Macron, qui, comme vous le savez, fait en ce moment l'objet d'attaques virulentes et d'appels au boycott dans le monde musulman? J'aimerais savoir, est-ce que vous êtes solidaire de la France quand elle plaide qu'au nom de la liberté d'expression, il doit être permis de caricaturer Mahomet?
D'abord, nous avons et nous allons continuer d'exprimer notre solidarité avec la France suite à cet attentat terroriste haineux. La décapitation, le meurtre de Samuel Paty est absolument inacceptable et injustifiable et nous nous joignons à tout le monde en condamnant cet acte et en restant solidaires avec nos amis et alliés en France. Mais nous sommes aussi dans une situation où les tensions s'enflamment, la rhétorique s'emporte et nous devons d'être à l'écoute et de travailler dans le calme pour empêcher un accroissement des tensions ou de la mécompréhension dans le monde. C'est pour ça que je vais prendre l'opportunité pour parler à des leaders mondiaux, des leaders communautaires, des leaders de la communauté musulmane ici au Canada, pour comprendre leurs inquiétudes, leurs préoccupations, pour écouter et pour travailler pour réduire ces tensions qui, dans un moment de pandémie et d'angoisse et de tensions élevées, ne doit pas avoir d'autres tisons pour accroître les flammes.
Alors, dois-je... Excusez.
Obviously, as we have and as we will continue to do, we strongly condemn the heinous terrorist attack, the murder of Samuel Paty, which was unacceptable and absolutely unjustifiable. We will continue to stand with France as it reels from this terrorist attack on an individual and on shared values. At the same time, we are seeing a rise in tensions, in anger around the world that need to be countered, that need to be reduced, that need to be listened to and worked through. We're in a time of a global pandemic where anxiety is up, tensions are up, people are frustrated, people are fearful. We need to work together to work through our differences, to listen to each other, and to go beyond the frustrations that people are feeling. That's why I will be reaching out to fellow leaders, but also to leaders in various communities, including the Muslim community here in Canada, to talk about how they see the situation and foster greater understanding and listening.
Et en sous-question, M. Trudeau, est-ce que je dois déceler dans vos propos une sorte de critique envers M. Macron qui a parlé de séparatisme islamiste? Mais plus généralement, je voudrais vous entendre, certains font un lien entre cette affaire et celle à l'Université d'Ottawa sur le mot en haine. Certains disent que dans les deux cas, on a puni un professeur pour avoir abordé un sujet qui dérange et que c'est seulement une différence de degré dans le fond. Vous, que faites-vous ce parallèle? Que pensez-vous de ce parallèle qui est fait? Merci.
Ce qui s'est passé en France, c'était un acte de terrorisme des plus haineux. C'était inacceptable, injustifiable et je pense que c'est complètement différent de tout autre acte. Nous devons d'être solidaires et de toujours se tenir debout contre ceux qui s'attaquent non seulement aux individus, mais à notre société, à nos valeurs. C'est ça la lutte contre le terrorisme et sur ce point-là, nous sommes de tout part avec nos alliés français.
Thank you. Operator, one last question over the phone.
Thank you. Merci. Prochaine question, Catherine Lévesque, la presse canadienne. À vous.
Oui, bonjour, M. Trudeau. J'aimerais aller dans cette même veine, surtout sur l'Université d'Ottawa, parce qu'à chaque fois qu'on vous a posé une question sur cette affaire, vous avez choisi de dénoncer le racisme, mais je voulais savoir qu'est-ce que vous pensez de ce qui est arrivé précisément à Mme Lieutenant Duval et la dénonciation de plusieurs professeurs qui disent qu'ils ne peuvent plus enseigner dans un climat de censure. Vous avez été enseignant vous-même. Est-ce que vous croyez que c'est le cas actuellement?
Une des responsabilités les plus profondes de tout enseignant, c'est de s'occuper et de protéger et d'amener les étudiants vers une meilleure connaissance du monde et une meilleure connaissance de soi-même. Et ça ne se fait pas si on, même par mégarde, blesse les étudiants qui font face à tous les jours à de la discrimination et du racisme dans la rue, dans leur vie, dans les systèmes qu'ils rencontrent. Nous devons d'être à l'écoute de ceux qui sont blessés par l'utilisation, même non avec des bonnes intentions du mot haine. Et à ce niveau-là, je pense qu'il y a certainement des leçons à en tirer dans un milieu académique et ailleurs sur comment essayer de comprendre la réalité de vécu de bien trop de Canadiens.
En suivi, Catherine?
Oui, pour revenir sur l'annonce d'aujourd'hui, j'ai un peu du mal à comprendre comment 500 millions de dollars vont réellement aider les plus grandes villes du Canada à construire du logement. Le communiqué de presse de votre bureau parle de 3 000 nouveaux logements. Je me demande, ça semble assez peu, donc je me demandais comment est-ce que ces fonds seront distribués là, entre toutes ces villes. Merci.
Je peux passer la parole au ministre à ce niveau-là.
Yes, so this is a very dedicated fund for rapid housing. It is targeting the most vulnerable in our communities. It is not the only housing mechanism and funds available to municipalities, to communities. We have the National Housing Strategy, which communities and municipalities have been using to repair, revitalize, and build new housing. So this is in partnership with that. But I can tell you that this particular rapid housing initiative is targeting municipalities and communities that have been asking us to help them acquire distressed properties, convert them into rapid housing, and to to enable them to also invest in innovations that can result in the construction of rapid housing in a matter of months and not years, and to also house people that they've been able to house temporarily through our federal Reaching Home program, to move them from that temporary housing into rapid housing. This rapid housing initiative will allow them to do exactly that.
Merci. On va maintenant passer dans la salle.
Bonjour, M. Trudeau. Louis Blouin de Radio-Canada. Je veux savoir comment vous expliquez votre perte d'appui quand même hier dans les 2 élections partielles. On a vu que Mme Paul a quand même bien fait, que les conservateurs sont concurrentiels dans la banlieue de Toronto. Est-ce que c'est un signe pour vous que des élections plus tôt que tard, ce serait préférable pour vous d'un point de vue stratégique? Mais aussi, j'aimerais ça vous entendre sur votre explication sur peut-être cette baisse d'appui qu'on a vue hier.
Évidemment, je suis très content d'accueillir 2 femmes fortes à la Chambre des communes qui remplacent 2 hommes qui étaient les députés auparavant. C'est une autre pas vers l'avant, vers l'équité dans notre Parlement. Des élections partielles, c'est toujours particulier. Dans des périodes de pandémie, c'est encore plus particulier. Je veux juste vraiment remercier tous les bénévoles, tous les candidats, tous les gens qui ont sorti, appuyé, participé et voté dans des élections partielles, dans une situation difficile, parce que ça démontre à quel point nos institutions sont fortes et notre démocratie continue de bien fonctionner. Et je suis très, très content de pouvoir accueillir 2 femmes incroyables en Marcy Ian et Yara Sachs à Ottawa pour continuer le bon travail que nous faisons en tant que gouvernement. I think the first thing is that I want to thank the volunteers, the candidates, the election workers, and all the voters who stepped up in this time of pandemic to participate in a fundamental democratic exercise. We recognize that it's a particular situation. By-elections are always a challenge, even more so in a pandemic. But the tens of thousands of people who came out demonstrate that our democracy is strong despite the challenges that we may be facing. I also want to highlight that it is with tremendous pleasure that we welcome 2 strong women in Marcy Ian and Yara Sachs to their seats in the House of Commons to replace 2 seats vacated by men. So we're steadily moving towards a more gender-equal parliament. But mostly, I'm excited to have these 2 individuals who are strong, powerful, compassionate members of their communities stepping up to contribute to the work, the important work that all parliamentarians and this government are doing to deliver for Canadians through this pandemic.
Prime Minister Mike Lecouteur with Global National. Through these press conferences, online ads, and even a televised address to the nation, you've tried to get through to Canadians to help them understand how important this is. Yet we still see house parties like the one in Chelsea, small town mayors that are begging not to have restrictions imposed to their communities. Your government promised a more targeted approach this time around, but more and more Canadians are already throwing up their hands in frustration with an even darker winter on the horizon. So what responsibility do you and your government take for the COVID-19 fatigue that so many Canadians seem to be experiencing?
We are in an unprecedented global pandemic that really sucks. It's tough going through this second wave. It's frustrating having shut down all of us, our lives through the spring, and now be forced to make more difficult choices and knowing that it's going to be a tough winter ahead as well. It's easy for us to want to throw up our hands. I think we have to ask ourselves who we really are as Canadians. Are we really good neighbors? Are we really people who care about the most vulnerable, about each other? I know we are. And it doesn't mean we're going to be perfect every step of the way, and it does mean we have to continually remind ourselves to follow public health advice. But I know Canadians can get through this together. And yes, we've seen rises in cases here and there. We've also seen flattening of the curve in other places. We know we can do this. We've done it before. And it's frustrating to have to explain to your kids in many parts of the country, like here in Ottawa, that we're not going to be trick-or-treating this weekend. And it's frustrating knowing that unless we're really, really careful, there may not be the kinds of family gatherings we want to have at Christmas. My 6-year-old asked me a few weeks ago, Dad, is COVID-19 forever? I mean, he's in grade 1. This was supposed to be his big year as a big boy, and they're not even singing in his classroom. This is really difficult. It's a time where we need to do the right thing. We need to lean on each other. We need to use all the tools we can. And we're not always going to be perfect. And we're going to have to rely on extraordinary frontline health workers, rely on community supports, rely on a government that, as we've said from the beginning, will continue to be there to support people who need to stay home, to support businesses who have to close. It's the only way we get through this. But we will get through this. Vaccines are on the horizon. Spring and summer will come, and they will be better than this winter. It's frustrating to have to go through this situation. Nobody wanted 2020 to be this way. But we do get to control how bad it gets by all of us doing our part, by provinces stepping up and making those tough decisions around who to close and where to close and when to close, by the federal government stepping up with income supports so that provinces can close where they need to, and all of us trying to deliver more tools to Canadians so that they can do their part, from masks to social distancing measures, to an app that's already been downloaded almost 5 million times right across the country, that thousands of people have used to notify friends and strangers that they should probably get tested. This sucks. It really, really does. But we're going to get through it by doing what Canadians always do, by pulling together, by working hard, and by knowing that better days are coming. C'est plate, ce qu'on est en train de vivre maintenant. Vraiment, là, il n'y a pas aucun d'entre nous qui veut être ici dans des conférences de presse avec des masques, avec des explications sur plus de cas dans nos CHSLD, plus de cas dans nos écoles, plus de restrictions qui viennent nous brimer, nous limiter, nous embêter dans notre vie de tous les jours. Il n'y a pas personne qui voulait cette pandémie, mais nous l'avons. Et de ne pas vouloir être dedans, ça ne va pas le faire disparaître plus vite. Nous devons tous de faire notre part. Puis on ne va pas être parfait, et oui, les gens vont faire des erreurs, et il va y avoir du mauvais jugement ici et là. Mais si nous voulons vraiment le faire, et si nous faisons de notre mieux, nous allons pouvoir passer à travers. Les provinces et les territoires sont là pour amener des recommandations sur quoi fermer, quoi ne pas faire, où ne pas aller, qui devrait rester chez eux. Le gouvernement fédéral, comme on a promis depuis le début, on est là pour appuyer les gens. On est là pour appuyer les entreprises. On est là pour appuyer nos aînés, nos jeunes, nos familles. On est là pour envoyer les forces armées, la Croix-Rouge quand c'est nécessaire. On est là pour aider. Et tout le monde va faire notre part. On a des outils de plus pour les Canadiens. Plus d'équipements de protection individuelle. On a une application gratuite qui va aider à empêcher les éclosions. Alors, téléchargez-la. On a plus en plus de compréhension, comme le docteur Njoo a dit, sur comment on va pouvoir passer à travers. Et on va passer à travers. Dans les mois à venir, on s'attend à commencer à recevoir des vaccins. Mais l'hiver s'en vient. La saison des grippes s'en vient. Ça ne va pas être facile. Mais on va passer à travers, en prenant soin les uns des autres, en étant là les uns pour les autres, en faisant notre part. C'est pas pour toujours. Mon fils Adrien m'a demandé il y a quelques semaines, « Papa, est-ce que la COVID, c'est pour toujours? » Et là, le membre de la GRC qui est avec moi s'est penché un peu vers moi pour entendre ma réponse parce que lui aussi, il voulait savoir quoi dire à ses enfants. Non, c'est pas pour toujours. Mais c'est pour encore un bon bout de temps. On va passer un hiver plate, désagréable à certains niveaux. Noël s'en vient. On va probablement, dans plusieurs parties du pays, pas pouvoir se rassembler avec nos familles, même si on fait vraiment attention dans les semaines à venir. Mais peut-être. Mais on sait que le printemps s'en vient. L'été s'en vient. Et on va pouvoir travailler ensemble. On va pouvoir bâtir un Canada encore plus fort. On a pu protéger beaucoup de gens. On a pu protéger beaucoup de nos petites entreprises, de nos institutions. Et quand on aura contrôlé ce virus, on va pouvoir revenir plus fort que jamais. Mais d'ici là, nous devons endurer. Nous devons faire notre part. Et on va passer à travers.
Good morning, Mia Rabson from the Canadian Press. What responsibility do you think governments and public health agencies have in some of the mixed messages that Canadians seem to be receiving? I mean, you yourself said a few weeks ago, if you just don't get together for Thanksgiving, maybe we'll have a shot at Christmas. And I think I just heard you say, well, maybe we won't be able to have Christmas. You keep seeming to move the finish line, and the messages are often mixed. What responsibility do governments bear in that, and how can you fix that so Canadians are now getting a constant message?
Well, I am, Mia, right now speaking to Canadians from one end of the country to the other. I have a responsibility as a federal leader to govern for all Canadians. And what we're seeing is situations that are very different in different parts of the country. Public health officials on the ground who know what is necessary in their community, what is needed in their community. So there is no one message we can give to everyone. Well, there was one message we could give to everyone in the spring. That was everyone stay home. Everyone don't go to work. Everyone lock down. And that worked in the spring as we flattened the curve. But now in this second wave, we have a better understanding of COVID-19. We have better tools to deal with COVID-19. And we can be a little more targeted. But yeah, that means a little more complicated in our messages. That some things we can do in some places that, no, you can't do in other places. And it's frustrating to see, friends at the other end of the country doing things that you'd love to be able to do, but you can't. But that's why everyone needs to listen carefully to what their best local public health advice is. And that's why my advice consistently is listen to local public health advice, and the federal government will be there to support people right across the country, regardless of the situations, regardless of the advice and the restrictions that have to be brought in by public health. We could have a simple unified message, everybody stay home, but nobody wants that. So we have a more targeted approach that provinces are designing, that the federal government is there to support the provinces on. And yes, it's more complicated, but it's also far less difficult and painful for all of us as a country to be able to do it in a targeted way and not a universal way. Je pense que on a déjà eu un message extrêmement clair pour tout le monde au printemps, quand on disait tout le monde, restez chez vous. À travers le pays, on a eu un confinement national. Puis ça fonctionnait au printemps. Puis il y avait un message très simple pour tout le monde. Mais dans la deuxième vague, on a des connaissances approfondies, on a l'expérience de la première vague, on sait là où des foyers d'éclosion ont plus de chances d'arriver et quel genre de comportement peuvent réduire les risques, et on peut avoir une approche beaucoup plus ciblée, ce qui aide énormément de gens et de communautés. Donc, non, on n'a plus un message pour tous les Canadiens. Il y a des messages complexes qui sont appropriés pour différents endroits, pour différents moments. Alors, mon message à tous les Canadiens, c'est toujours pareil. Écoutez les instructions de vos experts en santé publique locale et le gouvernement fédéral va continuer d'être là pour vous. On est là pour appuyer les petites entreprises. On est là pour appuyer les familles. On est là pour appuyer les travailleurs. Parce qu'en s'appuyant, quand on doit fermer, quand on doit faire des sacrifices, en s'assurant qu'on est là les uns pour les autres, c'est comme ça qu'on va s'assurer que quand on passera au-delà de cette crise, on va pouvoir rebâtir rapidement et même mieux qu'avant. C'est ça l'engagement qu'on a pris en tant que gouvernement fédéral et on va continuer de travailler avec les provinces et avec tous les Canadiens pour faire tout ce qui est nécessaire de façon ciblée pour pouvoir passer à travers.
Hello, Prime Minister. It's Annie Bergeron-Oliver with CTV National News. Yesterday, the procurement minister said that Canada could be at risk of not getting a vaccine in a timely manner if the Conservative opposition motion passed, which it did. Is your government alleging that big pharmaceutical companies will not sign billions of dollars in contracts simply because Parliament wants to review pandemic spending? And also, Canada's expected to hit about 10,000 deaths today. That's a very grim milestone. What do you think could have been done differently, and what do you say to the families who have lost someone to COVID?
What we are living through is a horrific national tragedy. Families have lost loved ones, been devastated by these tragedies. And we need to know that there are more tragedies to come. And we need to be there for each other, and we need to try and keep them as low and infrequent as possible with everything we know. But it's still going to be a very difficult time for many Canadians. Are there things we would have done differently? Absolutely. Every day we learn things about this virus. Every day we learn more about what works and what doesn't work. From the very beginning, we based our decisions on the best possible advice from the best possible experts we could find. But at the same time, obviously, we're learning that some things work better than others. And that's part of the process on how we make sure we're moving forward in the best possible way. In regards to the Conservatives' motion, it was expressed to us by a number of important private sector actors that there are concerns around competitiveness, around confidentiality of contracts, around things like that. And we're going to work, as we always do, to be as transparent as possible without putting at risk Canadians or their well-being. This is something that all Canadians expect of their government and of parliamentarians, and we will work with Parliament to try and ensure that we're getting as much information to them as possible, while at the same time not putting at risk Canadians. There is a tremendous amount of interest in vaccines around the world, and companies have choices. But we're going to make sure that Canadians get the safe vaccines that they need to get through this crisis. And we will continue to be transparent and open with Canadians about how we do that.
Hi, Prime Minister. Tom Perry with CBC. I'd like to ask you about the COVID Alert app. BC and Alberta have not signed on to it. Dr. Bonnie Henry out in BC yesterday was talking about they'd like to see some changes to better pinpoint when people were exposed to someone with the virus. Is it possible at this point to make those kinds of changes, or are you going to have to proceed with the app as is, but without BC?
We have, from the very beginning, put privacy at the top of mind in developing the COVID-19 app, because we know that that is something that matters deeply to Canadians. That if you have an app that does all the things that our scientists and doctors would love for the apps to do, not many Canadians would be likely to download it because of privacy concerns. And we've always had to try and find that balance right. And what we did was created an app that is totally private, totally anonymized, and totally voluntary by the user. We encourage people to make sure they plug in the code so that if they test positive, so that it can alert their contacts. But that is a voluntary choice, that thousands upon thousands of Canadians have done and done their part. We're always looking for ways to improve it, and they're actually we are looking at doing a better job of pinpointing moments of exposure and moments of testing so that the app can be even more accurate and it's not alerting people who were exposed well before someone tested. And that's a change that is very much in the works. And I hope that people in Alberta and BC who can right now download the app, but will only be notified if someone got tested in a different province and plugged in. I really hope that BC and Alberta listen to the many British Columbians and Albertans who would love to have this additional tool. It's not the panacea. It's not the one thing that's going to fix everything, but it is another important tool in our toolbox that has prevented thousands of cases across the country. And as we reach close to 5 million Canadians who've downloaded the app, close to a significant percentage of our population, I think it's close to 15%, we're at a place where it is having a real impact. And the more people around you have downloaded the app like you, the more you will be safe, which is why we're encouraging everyone to do it. But in the important trade-offs, we went with protecting people's privacy, protecting people's autonomy as the top desire. And even though certain very thoughtful doctors and scientists would like to know more, we feel that having the largest number of Canadians comfortable downloading it and using it is the right utilization of this app. Different countries have done different things, but I think Canadians can be proud of the approach that we've taken.
Thank you, Prime Minister. This is all the time you have for us today. Merci, Monsieur le Premier ministre. On va maintenant reprendre les questions dans la salle. Dylan?
Sure. Hi, Minister Hussen. I had a few questions about the national housing strategy and when it comes to transparency. The NDP had data showing that most of the co-investment fund had not been spent. Most of it went to Ontario. The same HC will not provide any updated data until it comes out at an order paper question. The decision to prorogue Parliament put that on the back burner. You're announcing more funding allocations, but there seems to be a lack of transparency in how much of the existing allocations have actually been spent already. So I'm wondering if you're going to commit today to more transparency in how the funding is actually spent.
On the co-investment fund, it's a really key part of the national housing strategy. And I can tell you right off the bat that British Columbia has actually received 15% of the total investments under the national housing strategy, over $2.5 billion since 2017. So we have those numbers and we have released them. The assertion that somehow British Columbia has not received its fair share of co-investment dollars is actually not true. In fact, we've spent more than the allocation when you take into account BC's population with the rest of the country. We've invested more than that ratio in British Columbia, $2.5 billion. In terms of the overall other programs like the Rental Construction Financing Initiative and the innovation dollars, we announce projects publicly. We have reporting that is required under the National Housing Act to Parliament that I have a duty to report to Parliament on an annual basis, and we do that. My predecessor did that as well. So I'm fully confident in our ability to not only flow dollars through the national housing strategy, different streams, but also to make those numbers public.
Sure. Just to clarify, I didn't mention BC. I just meant in general that there's not a lot of transparency around this stuff. And my follow-up question to you is about the National Housing Advocate. This was part of the legislation that was passed in June 2019. If this is a priority for your government, what's the holdup? It's been 16 months.
There is no holdup. We were doing, of course, we were going through a number of recommendations brought to us by different stakeholders of folks that they'd like to see in the council. Obviously, it wasn't just the advocate; it was also the National Housing Council that's supposed to work and help the advocate to implement ambitious targets in the national housing strategy. So that work is ongoing, but I'm happy to inform you that we're very much in the final stages of that work, and we will be unveiling the new National Housing Council as well as the Advocate very shortly.
Bonjour, Monsieur Leblanc. Question de mes collègues de l'Alberta. D'autres mauvaises nouvelles dans le secteur pétrolier ce matin. 25 des travailleurs de NOUVEAUX vont perdre leur emploi après la fusion avec Husky. Les travailleurs du secteur pétrolier reçoivent des mauvaises nouvelles après mauvaises nouvelles ces derniers mois. Qu'est-ce que vous pouvez leur dire? Qu'est-ce que votre gouvernement peut faire pour rassurer ces gens-là qui voient les mauvaises nouvelles se répéter?
C'est une discussion continue que j'ai et mes collègues ministres ont souvent avec le gouvernement de l'Alberta. Moi, j'ai parlé à plusieurs reprises avec le premier ministre Kenney à cet égard. On est conscient de la difficulté extraordinaire, économique extraordinaire que fait face l'Alberta. C'est un peu le même contexte dans ce secteur-là, par exemple à Terre-Neuve et Labrador. Nous avons des programmes qui ont appuyé plusieurs secteurs de l'économie, mais c'est une situation mondiale. Le défi dans ce secteur-là n'est pas isolé ou n'est pas unique à l'Alberta ou à Terre-Neuve et Labrador. Alors, nous allons continuer dans le programme des puits abandonnés. Nous avons pu avoir une entente pour $1 milliard. C'était une façon de contribuer à l'emploi en Alberta, mais on peut faire plus et on peut continuer de travailler avec le secteur et le gouvernement de l'Alberta afin de trouver des façons d'aider ces gens-là.
Je vous amène dans l'est du pays, dans la bulle atlantique. Il paraît qu'il y a une agence de voyage d'Halifax qui veut élargir la bulle atlantique pour que certains hôtels à Cuba, ce soit possible d'y aller, de revenir sans qu'il y ait de quarantaine, etc. Vous pensez, est-ce que vous aimez Cuba? Est-ce que vous pensez que c'est une bonne idée, de manière plus générale, d'élargir la bulle comme ça?
Bien, moi, je suis allé plusieurs fois à Cuba avec le premier ministre Fury de Terre-Neuve et Labrador. Il peut peut-être commenter là-dessus aussi. Écoutez, la bulle de l'Atlantique, les mesures qui ont été mises en place par les gouvernements provinciaux de l'Atlantique ont eu un effet positif en termes de la santé publique, il n'y a pas de doute. Il y a des conséquences en termes de commerce, en termes de voyage. Noël s'en vient. On a tous la parenté qui habite au Québec, en Ontario, dans l'Ouest. Alors, ça sera très difficile. Évidemment, le contexte d'aller sur les voyages comme ça, les autorités de santé publique ont bel et bien défini ça comme quelque chose qui n'était pas peut-être une bonne idée et les gens seront sujets à la quarantaine de 14 jours quand même. Alors, c'est une façon d'essayer peut-être de redémarrer un secteur de l'économie qui a été durement frappé, mais ce n'est pas une idée très propice dans le contexte actuel.
Thank you, Minister. We'll go back to the phone for 2 questions. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. Next question, Ryan Tumulty, National Post, line open.
Yeah, hi. I guess this is best posed to Minister LeBlanc. I'm wondering, based on what we've seen in Parliament in the last week, the confidence vote last week, and then the vote on Health Committee last week, does the government still feel that this Parliament is functioning well, that it can continue to contribute, I guess?
Well, of course we do. Canadians expect parliamentarians in the Senate or in the House of Commons to work together in the context of the pandemic, of the economic and public health emergency that the country finds itself in. I've had the privilege of being in Parliament for almost 20 years. And if somebody had said to me that we would pass multi-billion-dollar pieces of legislation to support Canadians and Canadian businesses with the level of unanimity that we've seen over the last number of months, I wouldn't have believed it. So Parliament is absolutely working in a collaborative way. It's certainly what we want to do as a government, and it's what Canadians expect. So I'm confident, for example, that some of the measures the Minister of Finance and the Prime Minister announced a couple of weeks ago that require legislative enactments. I'm confident that we can work with opposition parties to put those in place quickly as well.
Following up, Ryan?
Yeah, and then just on the housing front, I'm wondering how many of these projects do you think could realistically be housing people this winter because I know there's concerns about congregate living settings being a place that COVID could spread, and certainly homeless shelters were part of that earlier in the year.
Very good question. Thank you. I want to take you back to April. We flowed $157.5 million additional dollars for the federal anti-homelessness program, which really went to over 62 communities and frontline organizations to combat that issue, and they were able to really successfully deploy those federal dollars to house people temporarily. So it worked, and we added another $237 million when I made the announcement for rapid housing. But the rapid housing initiative is going to go to folks who are ready and who can demonstrate, whether they're municipal governments or indigenous organizations or nonprofit organizations. It's going to go to folks who can demonstrate that they can turn that investment around and build rapid housing in a matter of months. And we expect, at least for the first stream, the major city stream, that they will be able to turn that into rapid housing before the winter. And I say that because they've already pre-identified properties, existing buildings that they can quickly convert to housing. We've also seen rapid improvements in modular housing where housing can be built in a matter of months. So I have full confidence that at least in the first stream that you will see a lot of housing being built before the winter, and for the second stream to be used before the end of 12 months. And that's exactly what the federal funding is supposed to go to. And it is in response to the Federation of Canadian Municipalities and other community organizations who've been calling on the federal government to provide them with the tools to acquire these properties to house people permanently.
Thank you, Minister. Operator, one last question on the phone, please.
Thank you. Merci. Next question, Jolson Lim, iPolitics. Line open.
Hi there. Thanks so much for taking our questions. First question for Minister LeBlanc. Many cities are still facing operating losses despite funds that have flown through the Safe Restart Agreement and from the provinces. Pandemic isn't going away soon. Is your government considering another financial package for municipalities?
No, at the moment we're not. We thought that it was an innovative and effective way in the Safe Restart Agreements to make these billions of dollars available in an unprecedented way to deal with operating losses of Canadian municipalities. As you know, municipalities are entirely under the jurisdiction of provincial governments. But mayors from big and small communities have talked to us about some of the enormous challenges they were facing, and their ability to raise revenues is obviously more limited than other orders of government. So that's why we put in place this matching funding where provinces also had to contribute, but the Government of Canada would contribute. We want to make sure all of that money is allocated and is available. But we're always willing to talk with provincial governments and municipal leaders that have real needs in their communities that aren't being met, because the challenge of not properly helping municipalities, I had this conversation with the mayor of Edmonton some weeks ago. They're providing frontline services to vulnerable people, amongst others, in their own communities. And you wouldn't want a situation in the context of the pandemic that these services were less available or somehow were diminished at a time when people need them most. So we'd be prepared to have an ongoing conversation as we do with provincial governments and municipal leaders. But for the moment, our priority is to ensure that that money that was allocated in a total $19 billion initiative is available, is spent quickly to meet those needs. And if it's inadequate, we would pursue that conversation. But to my knowledge, provincial governments haven't come back to us and said that we need to find more money at this particular moment.
Following up, Mr. Lim?
And a question for Minister Hussen. On the goal of ending chronic homelessness that you mentioned earlier, is there going to be a timeline or strategy going to be produced for it?
The strategy, parts of the strategy are already in place. A $55 billion national housing strategy that is continuing to build housing in all forms for all different kinds of populations. There is hardly a week that passes by where we're not making 1 or 2 or 3 housing announcements in other parts of the country. And then this rapid housing initiative is another piece of that strategy. But we will, of course, be looking at other ways in which we can ramp up our response to chronic homelessness in Canada. The opportunity is there as we build back better, and I think the fall economic statement will also be addressing that.
Njoo. Hello, you got a question. Trudeau just now said that lockdowns worked in March, but that nobody wants that full lockdown now, but also nobody wants to be fighting COVID-19. Daily case counts now are higher than they were back in March, and deaths are rising, and fatigue is also setting in. Would a temporary lockdown like one that we saw in the spring help right now to flatten our rising curve, and would it potentially shorten the time that all of us are dealing with the impacts of the second wave?
Thank you very much for the question. You're right. I think what we're seeing around the world, including obviously here in Canada as well, is that people are suffering from COVID fatigue. I think with the first wave, it was easy, as the Prime Minister said, it was a full lockdown. Everyone stay home, don't go to work, and we flattened the curve. But we want to get back to as normal as possible, the functioning of society. And so what is that sweet spot, that balance in terms of accepting that there will be a certain level of activity of COVID-19, but not to the point that it overwhelms our public health and healthcare systems. And so I think that's the challenge in front of all of us here in Canada. And the other part I think that's important to note is that we are a big country. You know, the situation in the Northern Territories is different from the Atlantic bubble as compared to British Columbia, Ontario, and Quebec. And so I think the most important thing is that we need to follow what the epidemiology is at the local level and listen to what local public health officials say. So when we talk about be it temporary lockdowns or temporary measures that could or should be put in place, I would certainly defer to local officials. Having said that, I think I would go back to basic principles. I think that you know, the things we need to do, I think we've been repeating them, you know, even today again. And I would say, hey, it's straightforward. You know, it's the hand washing, it's the wearing of masks as it's appropriate. You know, stay home if you're sick. You know, physical distancing, all that's important. And also we, as a variation in English, we've been using the 3 C's, because certainly what we've seen in other countries and here in Canada is that if you looked at where outbreaks tend to occur, it's certainly in settings where, you know, it's crowded places, where there's lots of close contact, and I would say continuous prolonged contact, and also, where it's enclosed and you don't have good ventilation and so on. So, you know, all that comes into play. But as we just said this morning, the challenge is implementing it. And I think there's certain things that public health authorities and local government can do. But at the end of the day, it really comes down to what individual Canadians believe they could or should do. And I think a term that we might be using more and more is something called social cohesion. What is social cohesion? I think it's really the capacity of Canadians to collaborate and also to support one another. And support one another is in many different ways. It could be looking out for your family members, thinking what you need to do to protect your elderly parents or your loved ones who may have underlying medical conditions. It's looking out for your neighbors. Maybe you have a neighbor that, because of personal circumstances, it's harder for them to get out to do grocery shopping. So I think, as the Prime Minister said, I think we all need to sort of band together as Canadians. It's not going to be because a government decides to put a lockdown measure that we're going to get out of this. It really is all of us understanding what the tools are that we have at our disposal, including, even the COVID alert app, and banding together and doing what we can on an individual basis.
Health officials said that Canada was at a tipping point. Since that warning, we've now topped 200,000 cases. We're about to hit 10,000 deaths today. Have we passed that tipping point, especially in the largest provinces, Ontario and Quebec?
It's difficult to say, what a tipping point is. I think if you look at what's happening around the world, and I certainly think look at what's happening in Europe, and I think it's obviously a cautionary tale. I think in many countries in Europe, look what's happening in France and Spain. Spain has sort of instituted sort of a national curfew and so on. The case counts per capita are higher than in Canada. So I think it's something we need to look at. I think at this point, to date, we have not overloaded, I think, at least the healthcare system. But you can see in certain parts of the country, we are starting to cancel elective surgeries because beds are being filled up by COVID-19 patients. So that certainly is concerning. We're also looking at the fact that in sort of long-term care facilities, elderly residences, there are quite a number of outbreaks. Compared to the spring, the actual number of cases in those outbreaks are less, but it's still concerning. At least we know what we need to do. So I think it's a matter of implementing the right infection prevention control measures and getting on top of that. But I would say that it's a bit of a plea, I think, on behalf of, both the public health community and the healthcare system. The doctors, the frontline workers, the essential workers, they're tired. Many of them are exhausted after what they went through in the spring. And I think it behooves all of us. We depend on them in our time of need if we become sick. And I think now they depend on us to do the right thing so that they don't even get further stressed by having patients come into the hospital. And even in public health, as I mentioned before, in the spring when we had lockdowns and cases came to light, when contact tracers for public health contacted these people and said, okay, who were you in contact for the past, let's say 2 weeks? People were able to mention, oh yes, 5, 6 people, I can count them on one hand. Now, unfortunately, what's happening is that when public health gets notified of cases, the number of contacts per case are 20, 30, 40s. It's unbelievable. It's certainly straining the capacity to do what we know is one of those priority activities, contact tracing. So I think at the end of the day, again, it all depends on individual Canadians. We all need to do our part.
Thank you. We have time for one last question.
Dr. Njoo, it's another one for you. We've seen a number of media reports that we're not seeing a large number of outbreaks in schools in Canada or even in the United States. We've also seen studies that suggest kids are actually efficient spreaders. So I'm curious what data Canada is collecting, what research Canada is doing on this, and what you at this point can tell schools, can tell parents about how this virus is behaving in schools.
Excellent question. Certainly what I can say is that you've heard a number of times we've talked about the Special Advisory Committee, all the chief medical officers of health, along with Dr. Tam, myself. We have regular meetings every week, and certainly this has been one of the topics of discussion, exchanging our respective experiences, what's been happening in schools, and so on. At the present time, we all appreciate that what happens in schools is not sort of happening in its own bubble. It really is a reflection of what's happening in the local community. So, in communities where the transmission of the virus is low, then we certainly have seen that the quote transmission in the quote the school setting is also low. So I think it's not that the schools on their own that are going to be the main drivers of what's happening in the community. It's the other way around. From what we've seen in terms of the measures put in place by authorities across the different provinces and territories, by and large, they've worked. We certainly aren't surprised because, as I said, they are a reflection of the general community. And so individual cases have popped up and they've been dealt with. But I'm not personally aware of huge school outbreaks where there's been continued sustained transmission among individuals in the school setting. There have been a few cases that have been linked, but certainly local authorities have been on top of it and investigated, and as appropriate. And I know in BC they've even, I think, closed a number of schools depending on the local situation. So by and large, I think we all recognize that keeping schools open is one of the important things to do for children's, their mental health, also for adults, parents who need to work. And I think we need to do everything we can to maintain our schools in terms of keeping them open and make sure that we focus on other quote areas where we can hopefully have a bigger impact in terms of stopping transmission.
And for Minister LeBlanc, now that both the motion last week to study We Charity failed and the Ethics Committee yesterday didn't seem to be successful, your government suggested that you would be willing to put forward a motion or have a study of We Charity. You had your own suggestions of how it would happen. Is your government still willing to do that, and if so, when?
Yeah, when you said you didn't mean me. I would put forward the motion. My colleague, the House Leader, had offered publicly to have a committee of the House of Commons set up that would look at the whole issue of pandemic spending, where there were successes, where there may have been challenges, what lessons we could collectively learn. So that offer, of course, remains open. The House Leader, I know, is having conversations with some of his counterparts. If there's an agreement around that, that was something that we thought would be useful for Parliament, and it would, to your question, also allow other committees of the House of Commons to be seized of other issues that are properly before them, whether it's legislation or other policy studies. So it perhaps is a way to make some of the work more coherent as between different committees to focus that particular effort on one committee. But of course, we're happy to continue to talk to the opposition about that. And my understanding also is in the Senate, the government representative, Senator Gold, was talking to his colleagues in the Senate about also having perhaps some structure in the Senate that could look at some of these issues as well. So that may become a reality in the Senate as well. I don't know where those conversations have gone, but again, the Senate is perfectly free to take up that issue as well.
Les élections partielles d'hier soir, êtes-vous inquiet du résultat que vous avez vu? Oui, vous avez gagné, mais la part du vote libéral a baissé. Les conservateurs montrent qu'ils sont encore concurrentiels des banlieues de Toronto. Est-ce que ça va vous empêcher de dormir la nuit?
Non, pas du tout. Au contraire, quand on gagne 2 élections partielles comme gouvernement, c'est une bonne journée. Imaginez-vous vos questions si on avait perdu une de ces circonscriptions-là. Alors, je peux concevoir les questions auraient été énormément plus compliquées puis agressives que la question. Une victoire, c'est une victoire. Puis une élection partielle est toujours compliquée en termes de participation. Une élection dans le contexte d'une pandémie, comme le Premier ministre a bien dit, est d'autant plus compliquée. Alors, on prend les victoires où on les a, puis 2 victoires comme ça à Toronto et 2 députés extraordinaires qui ont été élus. C'est une très bonne chose pour nous, le gouvernement, pour le Parti libéral. Je suis tout à fait enthousiaste. Je ne suis pas pessimiste. Je vais bien dormir ce soir. Merci. Oh, you're the Prime Minister in English on the same question. You get Louis to say en français, s'il vous plaît, and then Tom says in English, please. The Prime Minister answered that. Thank you.
Thank you. This is today's presser.